Hi, Dr. D. Pasquale from NSI, and I want to talk a little bit about stroke and what that represents. Now, when we talk about post-stroke syndrome or post-stroke symptoms associated with that disease, remember that there are two types of strokes. There is ischemic and then there is hemorrhagic. What that means is that one is a clot where it limits the amount of blood flow to neurological tissue. The other is hemorrhagic where we have a blowout, and essentially, again, both are the same. It limits blood flow to neurological tissue, but with a blowout we also see direct compression or direct damage as a result of the blood. The blood can be very acidic and ultimately can affect brain tissue in that way. So either way, we're dealing with damaged neurological tissue, in this case brain for the most part, but we can also see some of those things associated with a spinal cord injury. When it comes to stroke patients, we've always heard in the past that once nervous system tissue is damaged, once nervous system tissue is lost, we can never get it back. And that's true in a natural setting, but now with stem cell therapy, we can actually repair and regenerate and improve the function of neurological tissue. The key is getting them to the areas that are damaged. So when we're talking about brain or spinal cord, our brain and spinal cord are well protected in the thecal sac, and essentially there is a blood-brain barrier or a barrier for things to go in and out. We can't get stem cells to the brain with an IV injection into the bloodstream. They'll just never get there. So what we have to do is we have to isolate stem cells from peripheral tissue. In this case, fat is the best resource, or adipose, primarily because our brain is made up mostly of fat. So using stem cells derived from that tissue can be very beneficial. When we inject them, we do a lumbar puncture. And the reason we do that is because we obviously want to get out of the way of the spinal cord. We don't want to risk injuring the spinal cord in any way, but we also have to get it into the thecal sac, and that's the only way that we can do that. Once present in the CSF, which is the cerebrospinal fluid, inside the thecal sac, they'll home to areas of damage, and they'll go and do what they need to do once introduced to that area. With stroke patients, obviously, the sooner we get them, the better. But it's okay to treat after the fact. And what we typically see is that it may require more than one dose. It's really important to have that conversation. If anyone tells you that it's not going to require more than one dose, I would be weary or leery of that organization, just because they may not have enough experience in this environment. I don't like to tell stories much, but my aunt, my mom's sister, had a stroke, a hemorrhagic stroke, not too long ago, about 2.5 months ago, as a result, from this recording, and we lost her. I mean, she wasn't there. She wasn't the same person. And after 2 doses, we have her back now. She's like interacting. She remembers who I am. She's a different person, and I'm really grateful for that. Obviously, with me and our organization, some of the things we do, she has direct access, so we got there really early. But I was able to see extremely amazing changes with her, and it's a pretty amazing thing. So I'm a huge proponent for stroke patients and getting them as soon as possible. I've already started a campaign to start to talk to cardiologists and some of these other organizations that people with strokes or with these types of injuries need to get seen as early as possible so that we can start the process of healing. Remember something, it's not that neurological tissue can't heal. It's just that our body in a natural setting can't do it on its own because we can't get stem cells in abundance to that tissue. We now, with this technology, are able to do that, and it's a really powerful thing.